All right, let's talk about something we're all swimming in: data. Every single day, our watches, our rings, our phones, they're collecting an absolute avalanche of health data. Steps, heart rate, sleep quality, you name it. We have all this information, but what are we supposed to do with it? That's the real question. Well, AI is promising to be the guide that can finally turn all of that noise into meaningful personal health advice. And today, we're going to look at a pretty amazing new blueprint from Google Research on exactly how to build that guide. It's kind of funny when you think about it. We have more personal health data at our fingertips than any other generation in history. I mean, that little device on your wrist probably knows your daily patterns better than you do. But just having the data, well, that's not the same as having insight. And that right there, that's the heart of the problem. This Google research isn't just about cooking up another AI model. It's about bridging that huge gap between just collecting numbers and actually understanding what they mean for you, and more importantly, what you should do about them. So, what's the big idea here? Well, instead of relying on a single generalist AI that's trying to be a jack of all trades, master of none, what if you had your own personal dream team of AI specialists? Imagine, each one an expert in its own area, all working together, just for you. This is where it gets really cool. The paper proposes what's called a multi-agent system. Now, that sounds technical, but just think of it like assembling your own personal health squad. You've got a data genius, a medical expert, and a personal coach, all collaborating to give you the full picture. All right, so let's pop the hood on this personal health agent. It's time to meet the individual players on the team and see exactly what each of them brings to the table. Now, these roles weren't just pulled out of thin air. The researchers actually analyzed thousands of real-world health questions from users and found they almost always fall into these four key buckets. So this AI team was built from the ground up to solve the problems people are actually trying to solve. First up, meet the numbers guru of the team. This is the agent that lives and breathes your personal data, and its job is to find the hidden stories inside all those metrics. Its whole world is computation and statistical analysis. So let's say you ask, hey, why has my resting heart rate been higher on Mondays for the past month? This is the agent that dives into your data, connects the dots between your weekend activity and your sleep, and comes back with a data-driven answer. Next on the team, we have the trusted knowledge base. This is the one that makes sure everything you hear is medically sound, accurate, and reliable. And this is absolutely crucial. The data scientist might find a pattern, like a high heart rate, but the domain expert is the one that provides the so what. It taps into authoritative medical sources to explain what that actually means in a clinical context. This adds that critical layer of safety and trust you need. And rounding out the team, you have the motivational specialist. This is the agent that helps you turn all those insights into real, actual change. Because, look, knowing you need more sleep is the easy part, right? Actually getting it is way harder. That's where the health coach comes in. It translates the data into a personalized action plan, maybe suggesting a new wind-down routine, and helps you track your progress in a supportive way. It's what turns an insight into a sustainable habit. Okay, so we've met the players. We've got a data whiz, a medical expert, and a motivational coach. But the real magic, the absolute core of this innovation, is how they all work together like a well-oiled machine. So here's the game plan. It's all managed by a central orchestrator. You can think of it as the team's quarterback. When you ask a complex question, the orchestrator doesn't try to answer it alone. No, it breaks it down into smaller pieces. It sends the data part to the data scientist, the medical context to the domain expert, and the what do I do now part to the health coach. Then it gathers all their input and crafts it into one single, seamless, and comprehensive answer. It's a true collaboration. So it's a great idea on paper, but does this dream team approach actually win games? Well, let's take a look at the scoreboard from the research. To find out, the researchers put their collaborative personal health agent, the PHA, in a head-to-head competition against a standard single-agent system. You know, the kind of AI that has to wear all the hats at once. And the results? Well, they weren't even close. In the study, clinical experts judged the answers and they ranked the collaborative dream team as the highest quality and most effective system, a whopping 80% of the time. This quote from one of the clinicians in the study just nails it. It really gets to the why. The team approach felt collaborative, it felt personalized. The single agent, on the other hand, felt generic and transactional. So in the end, having a team of specialists didn't just give a better answer, it created a fundamentally better, more human experience. So let's zoom out for the big picture. What does all this mean for you? Now, you can't go download this app today, but this research gives us a really powerful glimpse into where personal health AI is going. It's really important to see this as a blueprint for the future, not a finished product. It's making the case for a huge shift away from these single, one-size-fits-all AI models towards smarter, specialized teams that work a lot more like human experts do. It's about building health AI that we can actually trust. So the next time you glance at your health data, just think about this. Maybe the single perfect advisor you've been looking for isn't a single thing at all. Maybe, just maybe, it's a team. And that could change everything.